You are going to love today's show because it's a bit controversial, folks. WebMD, a pharmaceutical doctor website, WebMD, it's a good one. They have said it's really far-fetched to think that mold could contribute to lung cancer. Wrong. If you don't know fungus, you don't know lung cancer. I got to tell you, hepatocellular cancer is caused by a fungal mycotoxin. We'll discuss that in the opening of today's show. Doug, how do I find a good doctor? I'll go over that with you. Dr. Mark Stengler is here. He's written a new book on healing prostate. What's that all about? He'll explain. And then when two mycotoxins are combined, walk into a bar, you got a cigarette and a drink, two mycotoxins. It's not 1 and 1 equals 2. It's far worse than that. We'll discuss that.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
For many, many years, I've been very outspoken, both in lay audiences and to the professionals. I spoke a few years ago to a group of oncologists, cancer doctors, about fungus mimicking or causing cancer. And it was one of the most nervous lectures. My knees were, bouncing together. I was so nervous, but they got it. Mold can induce cancer. One of you sent me this, fungus and cancer, lung cancer. According to the medical website WebMD, this is a bunch of medical people, good people, and I quote, mold can cause health problems, especially allergies and asthma, but you probably don't have to worry about it leading to lung cancer. No research directly ties mold and lung cancer. In fact, it's pretty far-fetched to find any connection at all. Well, let's erase that far-fetch. The sad thing about this is read by nurses and doctors and medical people, WebMD. They get their information from that. And I think this is wrong. I think there's plenty of research that indicates that mold can mimic cancer growth, and aspergilloma, a sac aspergillus fungus in the lung, mimics lung cancer on x-ray and exam. Did you know that? Let's study it. Medical journal Lung said in 2013, what's that, about 8 years ago, in this retrospective study, we reviewed clinical and computed tomography, or CT findings, from 27 patients who presented with suspicion of thoracic malignancy, lung cancer, who were ultimately diagnosed with fungal diseases. Folks, I need to tell you, all 27 of these people were diagnosed with lung cancer. And yet they found 27 of these people that had these 7 different fungi were discovered in these patients' lungs. The story goes on to say we put these people on antifungals and they healed. Now, I wonder how many people the doctors have diagnosed with all our sophisticated equipment, and the doctor says, you have lung cancer, let's start on chemotherapy and radiation therapy and so forth, without testing for fungus. This, I don't think, is rare. Let's go to the same journal. It says this. Fungal infections can present with clinical and radiological findings, that means doctor exam, blood tests, and x-rays that are indistinguishable from thoracic malignancy, such as lung nodules or lung masses. Fungus can grow in lumps. Because the management and outcomes of fungal infections and malignancy are entirely distinct, the establishment of specific diagnosis is critical to provide the appropriate therapy. There's a lot of difference between a lung cancer and a lung fungus. When you begin chemotherapy, it itself drives the immune system down, you know that, and anything opportunistic in your body can begin flourishing. Fungi are opportunistic organisms. Okay, here's another medical journal, Mycoses, said a year later in 2014. A variety of fungal pulmonary infections can produce radiological findings like x-rays that mimic lung cancer. Radiographic findings and clinical manifestations can be highly suggestive of lung cancer, and misdiagnosis can significantly delay the initiation of appropriate treatment. Wow, how right they are. Everything's lung cancer, is it? So, WebMD, is it pretty far-fetched that mold can cause lung cancer? Get this, certain species of Aspergillus mold, a mold that we humans are commonly exposed to in our food and our air supply, make cancer-causing poisonous byproduct called mycotoxins. One Aspergillus mold mycotoxin called aflatoxin B1 is linked to lung cancer. Now just stay with me here. Aflatoxin B1 is well known as a potent carcinogen. That means it causes cancer. Epidemiological studies have shown an association between aflatoxin B1 exposure and lung cancer in humans, says this medical journal. Cancer researchers have now identified 6 mold mycotoxins, one of them is Aspergillus, are possibly or definitely linked to human cancer. I feel so compelled to tell you this. 6 years ago, it was discovered that a toenail fungus drug called Sporanox or itraconazole was approved as an anti-cancer drug. Coincidental that it only cured toenail fungus or fingernail fungus, and now it's helping cancer people? Is there a fungal component to lung cancer? I think this company that posted, far-fetched, I think they're wrong on that. I think they're right on most things. I think they're wrong on this. When you have lung cancer, please get the doctor to do 2 biopsies. One goes for cancer, one goes for fungal testing, okay? Hope that helps. John, one would think that that's a very minimal question. You know, how do I find a doctor who knows fungus? It's very deep. It's very maximal, if you will. Number one, doctors don't learn mycology during microbiology. Well, little yeast, ringworm, vaginal yeast, toenail fungus, but not the lungs, the liver, the pancreas, the brain being impregnated with these things to the point that the patient's health deteriorates and their life is at risk. How do you find a doctor who knows about fungus? I've had Know the Cause on television for 22 years, and thank God there are now a lot of physicians who are beginning to think this way. Couple that with the Center for Disease Control, kind of the overseers of microbiological diseases, saying finally the last 5 years, teaching doctors, you must think fungus. If those pills aren't working, talk to your doctor about fungus. What doctor, if he or she wasn't trained in their medical training about fungus, is going to say, oh yeah, I've been wrong prescribing all those antibiotics. What you really had was a fungal problem. Houston, we have a problem. Not many doctors know about this. What would I do? I'd dip into a health food store because many doctors' wives shop in health food stores, little local ones where you live, and say, is there a doctor or a doctor's wife who comes in here because he or she is concerned about their nutrition? Maybe he or she would know that this big thing on my neck is a fungal growth, or one problem or another is linked to fungus. Also, compounding pharmacies. Every little city like the one I live in has 1 or 2 compounding pharmacies. These are physicians who order nystatin for their patient and then want the glues, excipients, binders, etc. taken out of the medication to where it's a fine powder again, the way it started. Those doctors usually think outside of the box, so ask a compounding pharmacist or the owner of a health food store if they know of a doctor who might know not only how to diagnose a fungal condition, but more importantly, how to treat it.
Have you been told you have hypertension or high blood pressure? It's called the silent killer because it's usually unnoticed until you get a heart attack or stroke. A recently published study has discovered amazing news. Garlic, one of our favorite antifungal spices around here, was shown to be just as effective at lowering blood pressure as the leading medication, which is called atenolol.
Friends, I always enjoy talking with Dr. Mark Stengler. He's been a friend of mine for many, many years. He's all the way out in San Diego. I'm here in the middle of the country in Dallas. Dr. Stengler, welcome to the show and thank you for joining us.
Oh, great to be back with you, Doug.
This new book, I became a fan of yours decades ago when you started writing all these natural healing books. This one, I really wanted to have you on because every male in the audience owns one of these. Healing the Prostate. The book has finally been written. There's a cover, Healing the Prostate by Dr. Mark Stengler. Best holistic methods to treat the prostate and other common male-related conditions. Because Dr. Stengler, they all are intertwined, aren't they? When you've got one problem, usually you have another one down there.
Well, that's true. In medicine, often they segment health into different sections. And, sometimes we need that with specialists. But the reality is, it's like you said, the body works as a whole. So if you have a problem in one area, say like men, like the prostate, you probably have other problems, with your diet, with your digestive tract, with your immune system, with the microbiome. So you're right, it's all interrelated. And the better we, help to address all the factors related to things like prostate health, the better the results we'll get.
Tell me, how many men, by the time they're my age, 71 years young, end up with prostatitis or inflammation, urethritis? How many men end up with problems surrounding the reproductive organ?
Yeah, by age 50, about a third of men, you start getting up to your young age, in the early 70s, 80s, you're really hitting about 85 to 90% of men have some type of prostate problem. Prostate enlargement, known as BPH, benign prostate hyperplasia, prostate cancer, of course, the second most type of common cancer in men. And then this whole category of prostatitis, very, very common in younger men and older men, causing all sorts of pelvic pain, rectal pain, urinary symptoms. So there's all these different issues which affect men. And then we have bladder issues on top of that. Men can have less efficient bladder function as they get older, and then they get frequent urination during the night, getting up 3 to 5 times a night, frequent urination during the day, urinary tract infections. So all these things affect men, and a lot of men, aren't aware that this is such a susceptible area.
It really is. Tell us now, the reason I wanted you on, Doctor of the Decade, the Association of Top Professionals, voted Dr. Stengler, used to be the Doctor of the Year, now it's a Doctor of the Decade. Mark Stengler has a DMD, a doctor, an naturopathic medical doctor, an NMD,
Right.
naturopathic medical doctor. So he's a doctor and a doctor, all put together. So in the couple of minutes we have left, given that 85% of men my age are having a problem, do you start with diet? Do you start with supplements? Do you start with changes? What does one do?
Yeah, normally when men come in here and they got their frequent urination, or you get up 3 to 5 times at night, maybe they got some pelvic pain, we use a combination. And they actually, I talk about in our book, The Healthy Prostate, they have actually studied this. So when men change their diet, get the simple sugars down, get more vegetables in, a balance of protein, they take some of the more well-studied supplements, saw palmetto, pygeum, rye pollen extract, and they get rid of the underlying inflammatory issues, including things like chronic infections, like fungal infections. When we do that multifactorial approach, honestly, Doug, we typically get much better results than the pharmaceutical drugs, which are currently being used by most doctors.
Totally agree. And then there is the diet link. Folks, I've always told men and women, before you get a pap smear, go in to see the OBGYN. Men, before you go to the urologist, get a digital rectal exam and a PSA. I'd be away from antibiotics themselves, fungal metabolites. I'd be away from alcohol, for a week or two. What role might mycotoxins and fungi play in this disease called prostatitis?
Well, I found it to be the primary factor. We find diet is a factor, but a lot of these men have chronic fungal infections, in a way almost trapped in the prostate, if you will. Now, this isn't just my opinion. This actually has been borne out in research published in the Central European Journal of Urology, so very mainstream. And they found that chronic prostatitis, chronic inflammation of the prostate, mainly is related to a fungal problem. And if you use an antifungal regimen, that's how you get the best results. And that's what I have found out throughout the years. I have men coming in who've had prostate problems for over a decade. Okay. And they've been on many antibiotics, which has made the problem worse. Maybe they've used supplements, but when we do an antifungal approach, it clears up, and they think it's miraculous.
Okay, quickly, in 30 seconds, antifungal approach. What do you mean by that?
Well, an antifungal approach would be something like, maybe for the Kaufman diet, low sugar, high vegetables, adequate protein, antifungal agents, things like oregano oil, caprylic acid, or I often will use some antifungal medications for a short period of time, say like diflucan, just to get that fungal load down quickly so the man can feel better, very quickly.
Yeah, the book is called Healing the Prostate. Dr. Mark Stengler is a physician in San Diego. He's been at this, folks, 25 years. I know we have here referred many people to him. While you're on TV with me, God bless you, Dr. Stengler. Thank you for the care and the love that you give these patients. Great news. Dr. Mark Stengler, the book is called Healing the Prostate. Get it now. Folks, in the field of mycology, the study of fungus, which I've been a student of for 50 years, I have learned a lot. In mathematics, 1 and 1 always equals 2. In the field of mycology, it doesn't. So one mycotoxin may be in bread, a fungal poison in bread. If you're on an antibiotic, it doesn't equal 2. It equals 14 or more, because the two working together really can injure a person who is taking those. So let's go down that road here. What's wrong with a cold beer and a handful of peanuts? I ask you that because this was my diet when I got back from Vietnam. I was 21 years old. I lived in California, had a little post-traumatic stress going on, and that was my excuse for drinking beer, right? But cold beer, you'd walk into a pub and a handful of peanuts, and it would take me a decade to realize this isn't good. It's not true. I realized it in 2 years, but a decade later I was thinking, I can't believe I used to do that, because peanuts are often impregnated with mycotoxins, and a beer is a mycotoxin. Certain fungi produce poisonous byproducts. We call these mycotoxins. They rarely operate alone, as working in pairs benefits them, but it hurts you. The occurrence of 2 or more mycotoxins in feed and food, feed is what animals eat, food is what we eat, leads to stronger negative health impacts, so 1 and 1 may equal 14. And that's just the way it goes, folks. And if you think about it, few of us, just get into one mycotoxin. I'll give you some examples as we go down, but going in with friends and having a beer and there's a big thing of peanuts and you just take a handful and eat those, you got to be careful. Once, I don't think it's a problem unless they're really impregnated with mycotoxins. And if your immune system is strong, probably doesn't affect you at all. It's as we age and get my age that our immune system waxes and wanes, and so those things you have to be more careful of. The feed industry has been performing mycotoxin in food studies since about 2004, relatively short time. Dr. Karen Nair published that up to 60% of global feeds, what we give to animals, contain more than one mycotoxin. The reason I bring that to your attention is because what do we do with that cow or that chicken? Then we eat that animal, right? So we're getting more than one mycotoxin. Not always, but 60% of the time, 6 in 10. Globally, one poisonous mycotoxin called deoxynivalenol, it's also called DON, is in wheat, barley, oats, rye, and corn. Contaminates an average of 57% of grain crops in Northern Asia, North America, and Central Europe. So no matter where you're watching this, you're probably getting in 57% of time in the grains, folks. After we harvest the grains, they can sit outside in the rain and they can begin to break down molecularly. And what happens is the mold, Aspergillus or other molds, can begin growing on them. Off they go, they become our bread, they become our pasta, and wham. Got to be careful. In 2017, a study found that in Africa, 75% of corn and that which we give to animal feed crops have been found to have 2 or more mycotoxins in them. In Africa, maize is a staple. And it's not surprising at all, folks, that in Africa we see such an increase in disease, certain cancers and so forth, because of their diet. I think African physicians understand this far better than doctors elsewhere in the world, because they have to deal with this. Hepatocellular cancer is caused by 2 types of Aspergillus mold that can grow on maize or on corn, okay? And they know that in Africa. Some people find pleasure in having a glass of beer and a handful of peanuts. Others find pleasure in smoking a cigarette with a glass of wine. The reason I bring that to your attention, when we roll up tobacco, right, and then seal it up, it can grow a mold on many molds, actually. They found many molds in cigarettes. But once again, you go out with friends. If you're a smoker, you'll have a glass of wine, a cigarette. You're getting much more than just the impact, negative impact of the cigarette with the mold and mycotoxins in it, and the wine with the mold and mycotoxins in it. Keep in mind that if those cigarettes and foods are contaminated with fungal poisons, the damage to your health, especially over time, can really be excessive. Okay, that's the take-home message here that I wanted to give to you. Interestingly, if you're exposed to mycotoxins, make a bowl of fresh organic broccoli the day of exposure. Broccoli seems to sop up the damage done in the gut by some of the mycotoxins. And there are really other things you can do. It isn't just one. One thing I always used to recommend for the patients of the doctors I worked with, if they're drinkers, before you go to bed at night, use psyllium hulls, P-S-Y-L-L-I-U-M. It seems to not only encourage regularity the following morning, but pure psyllium absorbs fungal mycotoxins in the gut. Okay? And then one thing I just wanted to land on this, it's important that you know out in health food stores, change your diet so you're not being exposed to these. But in health food stores, we have things like this. Many safe supplements, vitamin D3, vitamin B3, niacin, B1, zinc, caprylic acid, apple cider vinegar, olive oil itself, have antifungal properties. Please, folks, if you're running from doctor to doctor and you woke up this morning and you hurt so bad and your tummy's just tied in knots and you're depressed, please think fungus. In America, that's becoming pretty common now. Talk to your doctor always about a fungal infection. It can do that. Folks, I hope you enjoy this program 20% as much as we enjoy putting it together and bringing you this new information. Please tell your friends about Know the Cause. So many times we'll call them and say, hey, fungus can do that. Well, that's, my doctor said that's not true. I'm presenting you with scientific data. Look, fungi, lung fungal infections can produce radiologic findings that mimic cancer. That comes out of a medical journal. Thank you so much, Dr. Mark, for being here today. Dr. Stengler's been a friend of mine for many years out in San Diego. His new book, I'm sure, is going to sell very well because our radiologists, our urologists, really don't understand that very often men can have yeast prostate infections or fungal prostate infections. And so I think his book will do very, very well. I'm very proud of him for that book. When you combine mycotoxins, as I said, it isn't 1 and 1 equals 2. 1 and 1 might equal 13. It's that powerful. So think before you smoke a cigarette and have an alcoholic drink. 2 mycotoxins together are real knockout punchers. Just be aware of that. Thank you so much for the loyalty you have shown me through the years. God bless you. I'll see you next time. Bye-bye.